or tenderness? No? Okay. Okay, Mrs. R, I'm going to have you open and close your jaw for me. Great. Okay, Mrs. R, I'm going to have you swing your legs that way. I'm going to give you a cup of water, and when I ask, I'm going to have you swallow that cup of water, okay? That sip of water for me. Okay, go ahead. Great. Okay, next I'm just going to check your arteries. Now we're going to get ready to check your eyes, okay? Can you look up for me? Great. Down. Good. Okay. Just going to have you follow my finger. Excellent. Okay. I'm just going to check and see how far out you can see, okay? So just follow my finger and let me know when you can't see it anymore. No. Okay. I'm going to stand on the other side. Follow my finger. No. Great. All right. We're going to shine a bright light in your eye just to check your pupils. Look straight ahead. Excellent. All right. We're going to get ready to just check your ears now, okay? All right. Sorry. That's okay. Any pain? Okay, I'm just going to take a look on the inside. Great. Okay. Okay. This is how I'm going to have you swing your legs that way. I'm going to block off one side of your ear, and I'd like you to repeat the letters that I'm saying into your ear, okay? Mm-hmm.
1, 2, 3. A, B, C.
Great. On the other side.
A, B, C. 1, 2, 3.
Great. Okay. Let's swing back around. All right, Mrs. R, what I'm going to do is I'm going to make this vibrate, and I'm going to put that on top of your head. And I'd like for you to tell me if you can hear it in both ears or just one ear, okay? Both ears. Great. All right. Just put your hair back, okay? I'm going to put this also now behind your ear. What I'd like you to do is to tell me when you stop hearing it, okay?
Okay. Now.
Okay. Do you hear it longer on your bone or when it's next to you?
Next to me.
Great. We're going to do the same thing on the other side. Okay. Next to me is longer? Next to you longer. Great. Okay, I'm just going to get ready to take a look at your nose and your mouth. Okay. Any pain or tenderness? Okay. I'm going to have you smell that. Can you smell it?
Absolutely.
Okay. All right, I'm going to take a look at the inside of your nose. Okay, Mrs. R, I'm going to have you open your mouth for me and stick your tongue out. And if you can move your tongue up and down and left and right. Great. Okay, I'm just going to go. And I'm going to have you say, ah, really wide and loud.
Ah.
Very good. Okay, next we're going to take a listen to your heart and your lungs, okay? So I'm going to have you actually first sit up and we'll check your pulses first. Your arm right here, one. Any pain? Swing your legs that way. Yep, you can sit that way. All right. Okay, Mrs. R, I'm going to have you take some deep breaths in and out. Good. And out. One more. Excellent. And once more. Very good. Okay, now I'm going to ask you to repeat the words 99, okay, until I tell you to stop. Go ahead.
99, 99, 99, 99, 99, 99, 99, 99.
Continue.
99, 99, 99.
Good. Okay. All right, just going to take a listen. Deep breath. Some deep breaths. All right, Mrs. R, I'm going to have you lay back down. We're going to take
signs of ecchymosis, lesions, or edema. I see that there's no signs of edema, ecchymosis, or lesions noted in his bilateral arms. Looking at his legs, again, no edema, no ecchymosis or lesions noted. So next, I'll be looking at his nail beds for shape and contour, angle and contour. So just looking, I see that there's no signs of cyanosis or clubbing noted. So next, I'll be looking at his upper and lower extremities again for skin turgor, capillary refill, temperature, and color, and appearance. So looking at his arms, so skin turgor is normal, no signs of tensing. Capillary refill is less than 3 seconds. His collar is normal for ethnicity. Skin temperature is warm. Moving on to his legs. Again, skin temperature is warm. Capillary refill is less than 3 seconds, meaning that he's getting good oxygen perfusion. There's no skin tenting noted. And again, his collar is normal for ethnicity and appearance is normal for both arms and legs. Next, I'll be palpating the radial pulse for rate, rhythm, and amplitude. Okay, so his pulse was normal. I did 15 seconds times 4 and got a rate of 70, and he's 2+ out of 4. So next I'll be palpating the brachial pulse for rate, rhythm, and amplitude. Okay, so his brachial pulse was normal as well. I did the 15 seconds times 4 and got 70, and he's again 2+ out of 4. So next I'll be palpating the femoral, popliteal, posterior tibial, and pedal pulse for amplitude. So we're doing his femoral, his popliteal, posterior tibial, and his pedal. So all pulses were 2+ and they were normal. So next I'll be doing his blood pressure. Okay. So his blood pressure was 110/70. That is normal for a healthy 18-year-old male. So next I'll be doing the ankle brachial index, and because I just took his brachial pulse, I'll be doing one his ankle. The ankle brachial index measures for patients who may be at risk for peripheral vascular disease. So anything less than 1 the patient would be considered at risk. Okay. So for his ankle, I got 125/70. So by dividing the ankle divided by the arm, the brachial, I got 1.14, which that is normal. So next I'll be doing the Allen test. So I will have the patient turn his arm around and have him pump his fists. So then I'll have the patient clench his fists, and I will be putting pressure on both the ulnar and radial pulses. When the patient lets go, I let go of the ulnar, and he gets good refill back into his hand. If I have him clench his fist again, go ahead and clench your fist, okay? And by letting go of the ulnar, he again gets good refill back into his hand. So next, I'll be doing the cardiovascular assessment on this patient. So I'll be inspecting the chest wall for contour, pulsations, and retractions. So just assessing his chest wall. I see there's no contour. He has no retractions. The apical pulse is in the appropriate location. So next I'll be looking at the jugular vein for pulsation. I'm going to have the patient lie back. I will then have the patient turn his head towards the side a little bit. I'm trying to slate just to see that there's good pulsation and both the A and V waves are present. Thank you. Back up. So next I will palpate the apical pulse for location and find the point of maximum impulse. So I'll go to the midclavicular line and I'll go down 5 finger breaths to find out the apical pulse is in this area. Okay, so next I'll be palpating and auscultating the carotid arteries. I'll be auscultating to hear for any signs of bruise. So I'll palpate first. Okay. Then I will be using the bell of my stethoscope. Contour of the pulse was normal and there were no signs of bruise noted. So lastly, I'll be auscultating for S1 and S2 heart tones for rate, rhythm, or if any extra heart sounds are noted. So first I'll be auscultating the aortic. So the aortic pulse was 70. I did 15 times 4. It was normal. No extra heart tones were noted. Next, I'll be doing the pulmonic. Okay, so again, I did 15 seconds times 4. I got a rate of 72. No extra heart tones were noted. So next, I'll be auscultating Erb's point. So again, I did 15 seconds times 4, no extra heart tones were noted, and I got a rate of 72. So next, I'll be moving on to the tricuspid. Okay, so again, I did 15 seconds times 4, I got a rate of 72, no extra heart tones were noted, and lastly, I'll be auscultating the mitral. Okay, so again, I did 15 seconds times 4, I get a rate of 72, no extra heart tones were noted. So that concludes both my peripheral and cardiovascular assessment. Do you have any questions or concerns for me at this time?
No.
Okay.
Hair. So I would be looking for symmetry, see if there's any bald spots, see if they are evenly distributed. I might even ask her to remove her hair tie and do that. And then I will be checking your temporal artery and checking for pulse. And then I would be also checking your eyes, make sure they are even, your eyelids, the color of your eyes, the nose, the mouth, the ears, and then I would be palpating your sinuses, so you let me know if there's any pain. So her hair looks good, the sinus feels normal, there's no pain, no tenderness. Her ears look good, nose, mouth, eyes, everything looks symmetrical. Her face looks symmetrical. I'm also going to perform a test here for her skin. So you tell me if this is dull or sharp, okay?
Yeah, dull, sharp,
Okay,
sharp,
okay,
dull,
okay,
dull, dull,
okay,
sharp.
okay. And then I'm gonna be checking for her lymph nodes. So we would be starting over here on her neck, behind her ears, over here, and down to her chin. I'm gonna check. And I'm gonna check here on her neck. And I don't see or feel any lumps. Do you have any pain?
No,
Okay, there's no lumps. I'm gonna check her clavicles. There's no lumps. Everything is nice and soft, nothing too big. I'm gonna check for her armpit, which it also looks good. And then here, it also looks good. I'm gonna check her thyroid. I'm gonna be going behind her neck and palpating everything here. And can you swallow for me, please? Okay, and swallow again. And it looks nice and even. There's no pain.
no,
And then can I have you look at me, and I'm gonna have you smile. So right now I'm looking for all the cranial nerves. Can you lift up your eyebrows? Okay, now frown your face and puff up your chin. Okay. And let's see. I'm going to gonna go look inside your nose, and your nares look good. I'm gonna have you look at me and open your mouth. Okay, and put your tongue out. Okay, and to the side, and the other side, and up and down. And her mucosa looks nice and pink and moist. There's no thrush or anything inside her mouth. Her gums look healthy. Inside her nares, it looks nice and pink. I'm gonna look in your ears. And in her ears, the tympanic area looks pearly gray. And same thing on the side. And I forgot to check one more thing. Can you say ah?
Ah.
Okay. And then I'm gonna have you close your mouth. I'm gonna check for TMJ, and I'm gonna palpate. Open your mouth, close. Okay. And crunch your teeth. Don't let me open. Can you bring your jaw side to side and forward, backwards? Okay. Now I'm gonna have you cover one nose and blow and then breathe. Okay, and do the other thing. All right, now I'm gonna be doing a smell test. So cover one nose, one there, and then close your eyes and tell me if you can smell that.
Mm-hmm.
What is it?
This is, I don't know the name, but smell good.
Lemon.
Oh, yeah.
Okay, with the other one. And
This is mental.
okay, so that's good. Then I'm also gonna do a whisper test. So I'm gonna have you plug this ear. And I'm gonna whisper and you repeat the 2 words, okay?
Cats and dog.
Okay, now let's do it with the other side.
Cow and pig.
Okay. Now, but then the other thing is I'm gonna point that at your nose to just check for your corneal reflexes, and it's good. Now I'm gonna check for the pupil. They're nice, equal, round, and reactive in your eyes, and they are. And now we're gonna do this test. We're gonna test her peripheral vision, so if you can cover one eye. And whenever you see the pen, you say now, but look at me, don't look at the pen. So
All right.
here we go.
Now.
Okay.
Now. Now.
Okay.
Now. Now.
Okay, let's do it with the other one, and we're gonna do the same thing.
Now. 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 Now.
Okay.
Now.
Now can you just look at this? Just focus on the pen. Just look at it. Okay. All right. So your pupils are nice, round, and reactive. Now we would do a Sneller test, which we don't have here, but is a vision test. We would have her stand 20 feet away from a chart. We would have her reading line 20. If she's able to read that, her vision would be 20/20. And that would be she would cover one eye, read that, and then cover the other eye and read that too. Okay. And now I'm going to perform we're gonna, also as I'm doing all of this throughout my examination, I would be looking at her skin and making sure that her color is nice, her skin is not too dry, she's not diaphoretic, there's no moles, nothing that I'm worried about. I would be looking at her legs as well. As I'm assessing each part of her body, I would be looking at that as well. I will be looking at her fingers, on her joints on the fingers, looking at her nails, they look nice and pink. I will be checking her capillary refill, and it's less than 3 seconds, so that's good. I will be doing the same thing on her feet, looking at her little toes and checking for capillary refill and the color as well. So I don't see anything, everything seems to be normal. So now we're gonna jump to the Respiratory Assessment. So this is my improvised pulse oximetry. So I would be checking her pulse. And it's all nice and normal. She is 97% of room air. And now I'm gonna come over here. I'll check her back for symmetry. Take a deep breath, and it looks nice and symmetric. And then I would be also palpating to make sure there's no lumps or anything. I would be looking at her skin. As I'm palpating, I'm also gonna do the CVA testing to check for inflammation of her kidneys. So I would be go down her back and putting my hand over, and then bump a little and let me know if there's any pain.
No.
And
No.
pain. Okay, now I'm gonna check for Fremantes. Can you say 99?
99,
Okay,
99,
okay,
99,
okay.
99.
All right. Now I'm gonna be listening to her lung sounds on the back. Take a nice deep breath. Let me know if you get tired or lightheaded. Okay. And I'll be listening here on all 5 lobes. Okay, and it's all nice and clear. Then I'm gonna be coming to her front. I'm also gonna check for symmetry. Take a deep breath. Okay, and I'm gonna be palpating and percussion. I'm gonna do the percussion on the back. And everything sounds normal. Okay. Now I'm gonna have you say 99.
99, 99, 99,